Have you ever wanted to read a cancer patient's mind? I'm Catherine. Welcome to the Inspired Vitality Show. Being completely open with our thoughts and feelings is harder for some than others. If you know someone with cancer, this video is your chance to gain insight into the hearts and minds of a cancer patient. A little over a year ago, I joined Twitter and have found hundreds of cancer patients who are loving and supportive of each other. They are sometimes funny or sassy and always honest. They are a kaleidoscope of people, all different and beautiful. This letter is made up of many pieces, or many people's experiences, because I asked the cancer community what they want their loved ones to know, but may not voice out loud. This video is dedicated to them. Dear friends and family, maybe you have known me all my life, or maybe we are newly acquainted. Maybe we live together, or maybe we spend our days together at work. I have something to tell you. Well, a lot of things to tell you. So settle in with a notepad and pen. You're going to need it. I have cancer. Maybe this is a shock to you, but I have been silently going through some testing, and now that I have a diagnosis, I need you to know. I need you to know that I understand you care about me and you don't know what to say or do. Ask me, and I'll tell you what would help me, because I may remember this moment and it could change our relationship. Some of you will become super supportive, and I may not hold back with you. You'll get the cancer card and the whole deck. This letter is for all others, with love and respect for insight. I need you to know that I'm scared, and hearing stories about other people you know with the same cancer, or about how I'm young and the treatments have improved, is not helpful. There may not be a logical reason for my cancer, and asking the cause can assign blame. I didn't eat the wrong thing or drink too much or stress too much. This is not my fault. As I go through more testing, telling me to be positive doesn't make the anxiety or scanxiety better. This is hard, and I am going to have some ups and downs. I may have surgery to remove the cancer, but there is so much more ahead that neither one of us can anticipate. After the surgery, my cancer is gone for now, and it could still come back. I may be unwell, but I can still make my own decisions. Don't feel like you have to make them for me. Please don't tell me to fight. Of course I want to live, but I'm not a cancer victim fighting in a battle. Words are powerful, and I'm just getting through each day the best I can, because there's no choice. Treatment is long and hard, but try not to look at me with pity. I'm still a normal human and have normal feelings. My body feels like it weighs 5,000 pounds after a round of chemo, and that's why I'm in bed for days. I literally can't get out of bed. Please don't be afraid to tell me about your everyday life. I need to hear what's happening with those I love, and I want to think about the everyday problems for a while. Yes, hearing about your child's tantrums and your husband snoring is a welcome relief from cancer. I find out that the long-term side effects of treatment are ongoing, some of them forever. Life does not always return to normal for cancer patients after treatment. It can be a life sentence, and there may be a time when I don't feel like I fit into my old life anymore. Like I will never be the same person I was before my diagnosis. At the same time, I can feel like the same me, but forever changed. You know, we really are all new people. All human cells turn over through the course of a 7 to 10 year period. With chemo, I killed off more cells faster, so I'm really a whole new me. reborn, and complete absence of peace of mind, and a new and extremely dark sense of humor, amongst other things. Losing my hair during treatment, I get it. But when it grows back lush and it gets taken away again because I'm taking meds to stay alive, that makes me sad. Don't try to convince me it looks fine. I see it. The same meds, they can cause pain. It's the kind of pain you feel in your bones, which makes you wonder if the cancer is back. The cancer has changed me physically, and I may not be able to do the things I used to be able to do. I hate that you can see how exhausted I am, even when I try to hide it. My dear friends and family, please listen no matter what. Celebrate when I'm doing well and comfort me when I'm not. Just continue to support me beyond active treatment. There may be times when I may hold some stuff back because it's less awkward, or so that your memories of me are not the chronic pain. Or maybe I'm going through some more testing again and I don't want you to worry. But you can always ask questions. I'm open to that. Cancer may have shaped me, but it will not define me. To the ones at the center of my heart, my children, I don't think it's fair that you have to live in a world without your mother. I can't guarantee that I can look down on you and protect you, but if I can, I absolutely will. Thank you for looking through the glass of the kaleidoscope and watching over us, where there is light and dark and pieces that don't fit together until you make another turn. See you soon.